we turn to tonight's special report. The president is sick. Millions of Americans have been sick. Many are sick now. Hundreds of thousands are dead. Many more will get sick and die before we are through this. That is just the glaring context for how President Trump handled getting COVID and mishandled it, how he failed to keep himself or his team safe, and how now, tonight, he continues to needlessly endanger the people around him, and how, like so much else with Trump, his own personal misconduct has served as something of a televised microcosm of his entire approach to governing. Everything I just told you is a fact. There's no satisfaction or joy in these facts, nothing to relish in reporting on the failures of a patient and a leader who we all hope fully recovers. But it is vital that we report these facts and that the nation and you and your friends and family be informed heading into this election. President Trump has now made 3 dramatic trips for his hospitalization. The trips there and back, accompanied by the TV fanfare and his social media posts. And both those trips were necessary for a patient who needed to go get hospital care. Then there is the superfluous 3rd trip. This should not just get rolled into another series of news cycles and forgotten. The president insisting on that Sunday car ride around the hospital to wave at supporters through the windows of his SUV. Breaking CDC guidelines, the trip endangered those inside the SUV for a publicity stunt, as doctors noted. And that ride is even contracting COVID could alter Donald Trump's approach to COVID policy. And that approach is very important to put under scrutiny right now for all the obvious reasons. And that approach contradicts itself. But it does boil down to 3 core moves. I'm going to walk through them with you right now. 1, deny and lie about COVID for political ends. 2, he endangers himself and others. 3, he tries to protect himself while endangering others. That may sound inconsistent because it is, but look at the evidence. Trump's own team always thought COVID would hurt Trump politically. So the entire strategy and Donald Trump's many well-documented lies were to downplay it even as he privately knew it was deadly.
It's going to disappear. One day it's like a miracle. It will disappear. That's a little bit like the flu. It's a little like the regular flu that we have flu shots for.
It did not disappear. Trump was not helicoptered back and forth to the hospital for a regular flu. COVID is killing more people in the U.S. than the death rate in similar countries. So that's number 1, the denial. And it's hindered the U.S. policy response and Trump's credibility on the issue. But 2, Trump's approach endangers himself and others. Consider that right now, the White House is one of the more dangerous hotspots compared to other places. That includes places with less funding, less doctors, fewer guards, because many other places are just filled with people following basic rules. But Trump spent months discouraging masks, undercutting his own CDC guidelines and rules for their use in the West Wing.
The masks, it's going to be really a voluntary thing. You can do it. You don't have to do it. I'm choosing not to do it. A lot of people don't want to wear masks. There are a lot of people think the masks are not good.
Many in the White House followed his lead, skipping masks even in tight indoor spaces, holding that recent super spreader event with 200 guests packed in like sardines. And when this outbreak hit, Trump's team hid crucial information about the virus's spread, posing extra risk to his own staff. These are people who have security clearances, they have inside access, and yet they found themselves learning about the spread in the news, as has been the case ever since. That's according to a senior Trump official, just as Trump's stage man's return featured him, currently contagious, ripping his mask off before going inside, leading experts to ask, what White House staffer would still want to go to work tomorrow? Epidemiologists want to vomit. Now, I just want to take a step back to stress the obvious here. Most public policies are not tested on the people who make them or on the White House itself. The president has a policy for schools or farms or prisons. The policy is not tested in real time on the president and his team. obviously. But because this virus can hit anyone, rich or poor, powerful or not, the nation is actually witnessing this strange process right now. You're living through a piece of history. The empirical medical fact check of the president's approach to COVID, which shows the approach failing. It fails to keep Donald Trump himself safe. Even with the advantages of the best security and health care in the country, the results are in. Trump's policy didn't protect his team. We're approaching 20 people who now got COVID, ranging from government advisors to the people running Trump's reelection campaign. This is obviously not what Trump wanted. Being sick, having his own team sick, drawing the campaign focus back to COVID when he spent months trying to shift it away to other things, law and order, crime, Supreme Court, basically anything but COVID. So why? I mean, we know from Bob Woodward's reporting that got so much attention and other evidence that Trump knew COVID was deadly. He pushed the propaganda to downplay it, to trick other people. So what happened? Well, it's clear at least two things. First, Trump broke a cardinal rule from mafia movies to the 10 crack commandments. He got high on his own supply. What began as a political effort to trick others boomeranged, with people in Trump's own orbit apparently believing all this propaganda that came from their own side to trick other people. How else can you explain this visage of these relatively informed adults, some of them senior citizens, taking such risk against their own self-interest? So that's part of it. The other piece of this is the sense of false security, because while Trump did endanger himself, he also relied on these hypocritical measures that he thought would protect himself. And that brings us to the third and final part of this approach that I mentioned, Donald Trump's moves on COVID, because he did secretly demand that people around him would wear masks and follow CDC-style rules just to protect him.
It affects virtually nobody. It's an amazing thing.
And he has asked why his valets weren't ordered to wear masks before this week.
He wanted the valets around him wearing those masks. It's the same double standard at Trump's medically dangerous rallies, indoor maskless events that endanger Trump's fans and his friends. COVID infections surged around that Trump rally in Tulsa. One prominent supporter, Herman Cain, soon died after contracting COVID. There hasn't been enough tracing to establish if he got it at that rally. Meanwhile, Trump literally admitted he was fine endangering people at church or at his own rallies as long as he personally was safe in his mind on that stage, quote, very far away.
Wouldn't it be great to have all of the churches full? So I think Easter Sunday, and you'll have packed churches all over our country.
Donald Trump just last night displayed reckless disregard for the lives of his own supporters at an indoor rally in Henderson, Nevada. The attendees were not socially distanced, and many were maskless.
Aren't you concerned about getting COVID, though, in a close way?
No, I'm not concerned. Because you know why? I'm on a stage that's very far away. And so I'm not at all concerned.
He wasn't concerned at all because he was very far away. He answered the question as the ultimate admission. He wasn't concerned about anyone else. That quote was telling when he said it. It's the premise for a sick joyride that everyone watched on Sunday. And this is how Trump's own team and protectors feel. Secret Service agents ready to take a bullet for the president are angry that the White House flouted rules on masks and distancing. Trump's own aides fearful they may have been exposed to the virus, with, quote, finger pointing over conflicting reports and the lack of information provided to them internally. Let's be clear. This is what Trumpism looks like. This is Trump's own aides facing the personal risk and cost of living under his policy and propaganda, his contradictions, and yes, his callousness towards other people's safety, even his people, as he likes to say. Now, I want to be clear with you, as I always try to be on these serious matters. There's no claim here that all of this could be prevented or that COVID infections automatically echo a given person's policy. The president's not the first politician to get COVID. Across both parties, we've seen it hit Republican Senators Cruz and Paul and Democratic Senators Kaine and Casey. And national policies rooted in medical science would clearly help, they're not a panacea. New York has followed CDC guidance far better than the Trump administration and some other states. It still has a punishingly high death toll. So the caveats are context. But this does boil down to something we need to take in. This is about facts and policy, not karma. If you want some kind of karmic moral reckoning for who's sick or not tonight, that's way above the pay grade of the newsroom. But I think the facts are actually clear enough by themselves. The White House is one of the safest, most heavily guarded places on earth. We all know that. Armed officials guard it 24 hours a day, ready to die to protect the White House and the president. But how do you protect against the danger posed from within when, in terms of national policy and physical health risks, the president himself is the danger? Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.